Raise your hand if you've ever run a marathon. Okay, what about a full marathon? That's 26.2 miles. Now, what about an ultra marathon? This is where races can be over 100 miles. Well, before I knew anything about sports nutrition, I ran a full marathon in San Francisco. It was my first and only marathon. It was something I had always wanted to do, so I signed up with Team in Training. Now, what I didn't plan on was getting pregnant halfway through my training. And now my 15-year-old daughter loves to tell people that she ran a marathon, which isn't totally a lie. Now, I finished the race, which I'm really proud of, but afterward, I ended up with minor stress fractures in both feet. At the time, I chalked it up to training in flat Florida and then racing through the hills of San Francisco. But looking back with everything I know now about nutrition, I can't help but wonder how much my terrible nutrition played a role. Because at that point in my life, optimizing for nutrition and fueling my body weren't really a thing. Welcome back to the Exam Room Nutrition Podcast. I'm your host, Colleen Sloan. I'm a PA and dietitian, and today we're talking about how nutrition impacts injury risk, performance, and longevity in runners. Today, I'm joined by Erin Colbach. She's an Australian sports dietitian with 17 years of experience. She's currently in the final stages of a master's by research where she's studying the relationship between nutrition, health-related risk factors, and running-related injuries in master's distance runners. In this conversation, Erin shares an overview of her research, but she also gets incredibly practical. We break down why carbohydrates are still so misunderstood and how you can explain their role in a way that patients actually understand. We also talk about an often forgotten nutrient in sports nutrition, fat, and why this is essential for training, recovery, and long-term performance. Now, even if you aren't a runner yourself, your next patient might be. And after this episode, you'll feel so much more confident guiding them with clear evidence-based advice. And fair warning to my American colleagues, I know you will love listening to Erin's accent as much as I did. And a quick reminder, if you don't receive my weekly emails, you are totally missing out. You can sign up for free at examroomnutrition.com/sign up, and you'll get a weekly note from me that has nutrition tips and trending nutrition headlines and how to talk about them with your patients. All right, well, get comfy or drive safe and enjoy my conversation with Erin. Thank you so much for getting up super, super early to record this episode with me. I'm really excited to learn from you and just to pull your knowledge all about sports nutrition today. So thank you so much for being here. Welcome to the show.
Thank you very much for inviting me to be here, Colleen.
Okay, so you have spent the last few years studying how diet and bone health contribute to running injuries, especially in masters athletes. And when I was reading through your research and I looked at masters athletes, that's athletes 35 and older, right?
Correct, yes.
Okay. I'm turning 38 in a couple of weeks. And I was like, oh my gosh, I would be a master's athlete. And I don't know if I want to take that positively or like negatively, like I'm going into the senior section, you know? So I'd love if you can give us a quick overview of your research and then what you've discovered.
So I've done my research as part of a master's by research degree, and originally came into the degree with questions about diet and running injuries because I'm a runner myself. I see a lot of runners that get injured in my practice, and I also see that dietary intake is quite often not up to scratch. So we ended up in our review with 15 studies that were eligible. We only looked at prospective cohort studies. So that was really the best quality of evidence we could get in this situation because randomized controlled trials are just unethical and too difficult to conduct in this situation. And we ended up with 9 that we could then meta-analyze. So we ended up with 6,000 runners in our review. And we found in that review that the female runners that were getting injured, on average, were consuming around 300 calories less per day than those that were not. The injured females were also consuming less dietary fat, so they were about 20 grams less fat per day compared to the uninjured females. And a really interesting finding we didn't expect was that for combined sex, both male and female, the injured runners were consuming less fibre per day. And it was only 3 grams less fibre per day, but it was still significant, which was, an unexpected finding. Overall, there were a lot of issues, not many studies. Most of these studies were done in US collegiate female athletes over in your country, Colleen. There were lots of inconsistencies in definitions of running-related injury. Statistics were quite variable, and also the quality of the evidence was overall sort of moderate, and the certainty was slow to moderate. So there were a lot of kind of concerns within that literature, and especially there was really limited evidence in the masters population, which is my interest area. So we then went on to do a cohort study with 100 runners here in Adelaide. They were all masters runners, both male and female. We got them in to clinic at baseline and did a bunch of measurements, including weight, body composition, bone mineral density. We did resting metabolic rate testing, energy availability questionnaires, big gamut of things. And then over the next 6 months, we followed them to see who got injured and who didn't. And if they did develop an injury, they had to report on that for us. They also recorded their diet at 3 time points during that time, and their weight as well, so we could check stability of data. From that study, we ended up finding 30 running injuries in our population of 100. And all of those, aside from one, were soft tissue related, which was interesting because we only really can then extrapolate our findings to soft tissue injuries, not bone injuries, which is, more what you would see nutrition might be related to in terms of injuries in runners typically. We found a very high prevalence of low bone mineral density. So we had about half our runners with a T-score less than -1, which was a really big surprise for us as well. We had to refer all of those people to their GPs for further assessment. And we found that in terms of the factors that increased risk of injury, those runners that had lower hip bone mineral density as a combined sex were at high risk of injury. And that was driven mostly by the females. We also found that for the hip bone density, they had lower T and Z scores in the injured group. And the females had a higher odds of injury if they had a whole body T-score less than -1 or a T-score less than -1 for any measure. So certainly some bone-related issues there contributing to injury risk. In terms of dietary factors, we found that for the injured runners, there was a significant association of meeting the recommendation for percentage of energy from a saturated fat with developing an injury. And that was a 2.9 times higher risk. Males that did not meet their calcium recommended dietary intake had a 4 times higher risk of injury. And females that were not meeting their recommended dietary intake for iron had an 80% lower odds of injury. So some interesting findings there. No associations found for energy, macronutrients, any other micronutrients or fibre. We didn't find any associations with depressed metabolic rate or energy availability questionnaires or eating disorder questionnaires. So some really interesting findings, which certainly identified bone health as a big concern in this population and potentially increasing the risk for injury, and also some concerns around dietary factors. But certainly, I think for our research, we need to do more. The population overall, we had about 50 male and female roughly. And I think if we had more in each subgroup, we probably would have found more results. There were quite a few things that were close to significance, but didn't quite make it there. So it'd be interesting to see how that would go with the big population.
Yeah, it's so fascinating. It's interesting to me that over 50% had low bone mineral density. And so I'm curious to why you think these masters athletes are uniquely vulnerable. And then let's bring this into the exam room for maybe a primary care PA. Should this alert them to any different screenings that they should do in this age group?
Yeah. The reason I went for masters specifically is probably because I'm biased and I am a masters athlete myself and I work with a lot of them, but also, our bodies are changing as we get older. Muscle mass and therefore strength can start to reduce, as well as bone. Now, evidence suggests that masters athletes, if they are, maintaining a good level of activity throughout life, they actually can maintain pretty good muscle mass. We've also got changes in sleep patterns that occur with older age, which potentially may have an impact on health and athletic performance and injury, and also more prevalence of health conditions. So even though, generally runners are going to be healthier, they're not immune to things like, heart disease and blood pressure and all those things that can happen. Here in Australia, and I suspect probably in the US as well, nutrient intake is often inadequate in this population, particularly for females' calcium. And also iron in those younger masters athletes. There are hormonal changes happening as we get older as well. So loss of estrogen, testosterone, those hormones are really important for protecting bone and also potentially a role in muscle as well. And so we're losing that protective effect. And in terms of screening differently, it's a tricky one, Colleen. We don't really have good screening tools for this population at the moment. There aren't really validated tools for masters athletes in assessing things like energy availability and risk of disordered eating. We certainly have those in younger populations. But yeah, we need to do some work to develop those tools. My advice at this stage, there's a couple of tools that I've thought possibly could be appropriate. There's one known as the Relative Energy Deficiency in Sport Clinical Assessment Tool, which is probably more of an assessment than a screening tool, but it's a very comprehensive tool that looks at a lot of biochemical factors. And the other one that's just come out is actually an Australian tool from a lady called Georgie Buckley. It's called the Athletic Disordered Eating Scale. And it's a nice short questionnaire, and it's athlete specific around disordered eating, which is excellent because we used a non-athlete specific eating disorder questionnaire in our study because this one wasn't available at the time. And it looks like this athlete disordered eating scale could potentially be quite appropriate for the masters athletes. But yeah, we do need to do some research to find out really what is the best tool there. And in the meantime, I guess use the best options we've got.
Knowing that some of these patients are at risk, what are some high yield nutrition or maybe even bone health questions can clinicians ask in their assessment of runners over 35?
Yeah, I think look, any questions that will give you clues as to someone's fueling levels or adequate intake for energy, in particular, I think are worth asking. So, things like, a history of bone stress injury, absolutely, I would be looking for that. That's a big red flag in terms of potentially underfueling, particularly if it's been happening in the last 2 years and it's one of the higher risks bone injuries like a pelvic fracture or a neck or femur fracture. I would be asking for your younger masters females about menstruation, whether that's happening regularly or not. That also can be a big red flag that they may not be consuming adequate nutrition, particularly energy. In terms of the older runners, it is really tricky. I would ask them if they've had a bone density scan. Some of them possibly may have. In Australia, we do have limitations on who gets a bone density scan and then can be getting Medicare rebate. I'd also be asking about vitamin D, whether they've ever had that screened. I would be asking them about their attitudes and perceptions of carbohydrates. I think that's a really key one. In our group of runners, we found that 90% of them were not meeting their carbohydrate requirement. I'm not surprised. I find that in practice as well. But now I've just got that lovely stat to tell everybody about. The carbohydrate target that we set it was not high. It was 5 grams per kilo body weight. The runners on average in our study were doing at least about 48 kilometres a week. Some of them were doing far more than that, plus that cross training. So 5 grams per kilo body weight is, a pretty reasonable sort of target. And I find in practice personally, a lot of the reasons why these runners are not consuming adequate carbohydrates is just misconceptions and myths around carbohydrates and attitudes towards consuming more carbohydrates and a lack of knowledge. They often just don't know what they need. I'd be checking bone nutrients, dairy intake. Obviously, we've seen that association with males. Potentially low calcium increases risk for soft tissue injury. Dairy is a source of calcium, so checking on that. Also knowing that many of those females in particular are not meeting those requirements, especially as they're older.
No, that's really helpful. So I want to recap. If insurance and reimbursement wasn't an issue and we all lived in a perfect world, possibly a bone density scan, vitamin D we could check, probably a CBC. Any other labs that I'm missing that would maybe, a clinician might want to do at baseline?
Yeah, so with the REDS-CAT tool, there are some biochemical indicators that are not necessarily just specific to younger adults. So you could look at doing thyroid stimulating hormone. So if that's low, that can be potentially an indicator of underfueling or REDS, which would you like me to give a definition for that now, Colleen?
Yeah, let's talk about that.
Yeah. So, yeah, many of your audience may have heard of REDS before. So it stands for Relative Energy Deficiency in Sport. and it's a syndrome that can occur in athletes who have chronic and or severe low energy availability. Low energy availability, I describe to my athletes as a situation where the athlete is not consuming enough dietary energy from food to meet the energy requirements for both their exercise and optimal physiological function. So if these athletes are in that chronic or severe state of low energy availability, they can then develop some, fairly significant systemic concerns with health that can affect all the different body systems. So this can include hormonal systems that can then impact bone health. We can have changes in metabolic rate where the metabolism is being depressed. We can see changes to immune function, so people are then more likely to get sick and stay sick longer, potentially increasing their risk for injury. We can see changes in lipids, so that's one you can check with your athletes is whether they've got elevated LDL cholesterol, which can be an indicator of RES. Also, you can have changes with mental health, so they might start to get depressed, anxious, maybe irritable, potentially sleep changes. Lots of different areas that can be affected. And as you'd expect, this can then potentially knock on to performance effects as well, where they're not performing as well in terms of endurance, strength, motivation to train. It's a big issue, and it's pretty widespread from what I have observed. But a bit harder to pick up in the older athletes. So I guess, you've got the thyroid-stimulating hormone, the LDL you could certainly check. Bone injuries you could check. So if they've had any of those high-risk bone injuries in the last 2 years, like the hip or the pelvis.
Do patients who have REDS also have an eating disorder? Like, do they come hand in hand or not always?
Not always, no. I think in practice, I do quite commonly find that it is people just actually have no idea how much nutrition their body requires to run. The energy requirements are a lot more, and people just get it wrong, particularly when they're new to the sport and they suddenly ramp up their training load and just don't change their food. Certainly disordered eating and eating disorders can be a contributing factor as well.
I think that's helpful. Okay, I want to linger on the topic of carbohydrates because I'm with you. This is so misunderstood and commonly underconsumed. Imagine I'm one of your, clients and you find out I'm underconsuming carbohydrates. How would you explain to me their importance and like why I should be eating carbohydrates?
Yeah, it's a really good practical question, Colleen. So how do I explain carbohydrate? I try and keep it really simple for them. So I use the car analogy, and that carbohydrates are fuel or petrol for your car. It is your muscle's preferred source of fuel for endurance exercise, especially for shorter duration, more intense efforts. But certainly, it's important as part of your fuel source for longer, slower efforts as well. And I explained that petrol tank has a limit. We can't store a huge amount of carbohydrate in that petrol tank. So the petrol really is, the glycogen, essentially, that's in the muscles and the liver. But sometimes those words are a bit, over the head of some athletes. So I explained we have a limited petrol tank. After about 90 minutes, that petrol tank is going to be fairly depleted, at which point you're going to start to feel tired. That fuel source, not only for your muscles, but for your brain is going to start to become limited. So that's going to contribute to the fatigue as well. And so I explained that we need to keep that petrol tank topped up to the right levels at the right time to do the work that we want to do. So if we are doing long sessions, we're driving a long way, we need a lot of petrol or carbohydrate in the tank. We also need to top up along the way sometimes too. If we are doing short, intense sessions, we're going pretty fast. We're burning a lot of fuel. If you're a racing car going around a racing track, you're not going to start the race with a half full tank. That makes no sense. So you need to put plenty of petrol in the tank for those sessions as well. Even if you might think, it's only an hour, whatever, there's a huge, really rapid petrol burn in that session. I also explained that carbohydrates are important as a way to keep our blood glucose level stable, which can help us to feel more alert and energized through the rest of the day as well. It's a brain activator in the morning, get us, switched on. And I explain not just the fuel side of things, but also that carbohydrates often come with other beneficial nutrients. You know, carbohydrates are in bread, cereal, fruit, dairy. These have lots of other nutrients that are really important for our health as well. They love the gut health part of it. Gut health is very topical at the moment, as you know, and carbohydrates are such an important fuel source for our gut microbiome. And that's often a good way to kind of get them on board as well.
Since we're on the topic of carbohydrates, can you kind of unpack the difference between running nutrition and just general health nutrition?
Yeah, people do get really confused about it. I think runners inherently like to be healthy and they therefore think they have to eat really healthy all the time. Um, and, they do need to be healthy, but they also need to be able to meet their high energy requirements and high carbohydrate requirement. And that can be challenging to do sometimes if you're focusing just on core food groups and nothing else. So in terms of running nutrition, I guess the differences are the energy and carbohydrate requirements are a lot higher than what they are for someone that's more sedentary. That really is probably the biggest difference. Possibly they may have higher needs for some micronutrients such as iron. However, we don't really have good evidence at this stage to say what those levels should be. So when I work with runners, my initial sessions, we often talk about the training diet and how that should look. And I explain to them that underlying their running nutrition, they need to have a good base. So we need to have a good base, meeting basic core food groups. That's a non-negotiable. We should be at least achieving minimum servings per day of core food groups for that really good diet quality. The extra energy requirements. So I talk to them about the fact that these sometimes need to come from perhaps less nutritious foods that provide some rapid acting carbohydrate as a fuel source that don't overfill the athletes. If we're trying to boost up energy and carbohydrate intake by eating more of the core food groups, we can end up with huge volumes of food moving through the gut, a lot of fiber. They can't eat it. It's just too much for them. And so they often can't meet their requirements because they're too full or their gut's just, too symptomatic and uncomfortable for them. So I talk to them about, using things like gels, sugar, lollies, cordial. I think you call that something else in the US. You probably don't even know what it is. You're kind of looking at
Cordial.
it.
No, what's cordial? I have to look this up.
It's like a sugar syrup that you add to water that gives it a flavour. I like to encourage them to use, cheap stuff. They don't have to use sport products. A lot of them think they do, but, you can use things like muesli bars and, lollies or candies, honey, jam, all those really quick acting carbohydrate that don't take up a lot of space, that are really easy to get down fast. And you use those around your key training sessions. So you use them before sport when you need that quick fuel, during, and potentially sometimes after if you need to rapidly recover because you've got another training session coming up in the next 8 hours or so. Some athletes I work with have a really high training load. So I've got some that'll be doing, 100 miles a week potentially for weeks on end in the lead up to some of their major events. So I work with a lot of ultra runners that do those really, really big volumes. And they need to eat a lot of these foods just every day, all the time, because for them, they're trying to get down 4,000 or 5,000 calories a day. If they're trying to do that with the 5 food groups, it's not going to work.
Yeah. Okay, so where does sugar fit in this? Because this is always a really hot topic. At least in the States, it's so demonized. And for general population, we want them to consume less added sugar. And so is this something that's a little bit different and sort of given maybe more of a permission slip for athletes since it is a good source of rapid acting carbohydrate?
Yeah, absolutely. 100%. I mean, essentially, all carbohydrates are eventually going to be broken down to glucose anyway. It's just that we want to make sure that for these athletes, that breakdown process is a lot faster so they can access that glucose faster. And also, those high sugar foods, as I said, they're often lower volume. They're more comfortable for the gut as well. So they can help them to meet those extra energy and carbohydrate requirements in a practical way.
Okay, we've talked about carbohydrates, but I'm curious in your experience, what other misunderstandings or maybe misconceptions have your clients had when it comes to their nutrition?
Gosh, where do I start, Colleen? Okay. So ultra processed foods, that's a really topical one. I get a lot of runners that come to me and they say, I want to run 100 miles on all natural foods. Oh, where do you start? Okay, have you got guts of steel? If you can eat, everything in sight and not feel awful, like maybe you could get away with that, but that's not going to work for most people. So, yeah, there's a lot of debate around the ultra processed food space at the moment, and I think a lot of athletes are a bit concerned about how they might impact their health. Um, Again, I kind of go back to how I talked before about, you want to make sure you've got that good diet quality underneath as the base. And then layering in some ultra processed foods strategically to help you meet the extra energy and carbohydrate needs is sort of the best way to navigate that story.
It's a very big hot topic around here too. Everybody's so afraid of it. Are there any other concepts that you wish clinicians would mention in the clinic to a patient, right? If this is just a primary care visit and the patient says, "Hey, I'm training for a marathon. Like, what should I eat?" Now, of course, if you are a listener of a long time, I will say they need to be referred to a sports dietitian. 100%. I always promote dietitians, but the patient sitting in front of that clinician wants answers. And so I would love if you could equip some of our clinicians listening, like what are some very high yield pieces of education that they can just give to that client sitting right across from them in a quick, a quick overview.
Yeah. So I don't know exactly what resources you use in the US for your athletes, but here in Australia, we have, and I'm going to give us a plug, we've got a wonderful website, which is the Australian Institute of Sport website. They have a great section on nutrition in that website with lots of athlete facing information. There are heaps of videos, educational worksheets. I use them all the time with my athletes. That's a really great place to go, and also a really, really great framework on supplement use in sport too, which is really helpful for helping athletes make decisions about whether to take a supplement and if they're going to, what the right protocols, etc. Many of my athletes, when I first meet them, we have to cull, a million different supplements that they've been taking, and they usually have no idea why they're taking it in the first place. But outside of that, yes, I would be making sure you're encouraging that diet quality, as I've said, to check that they're meeting their core food groups. But then also talk to them, I guess, a bit like how I have about the carbohydrate story, that they need to increase carbohydrates around key training sessions. I would educate myself on the position of the Academy of Nutrition and Dietetics, Dietitians of Canada, and the American College of Sports Medicine from 2016. And it outlines things like the carbohydrate requirements for athletes in terms of daily requirements, but also recommendations before, during, and after sport. I find those before, during, and after sport recommendations are key starting points for my athletes. If they can get that right, they're going to increase their daily carbohydrate intake without even having to think about the rest of the day. It's really simple and straightforward. It also gives advice on protein intake and fluids as well. So it's a really good document. It is a little bit old now. I'm sure there'll be updates in the future. It's also worth having a look at the REDS IOC consensus statement. The latest one was from 2023. It will give you great education about what is REDS and low energy availability, some of those signs and symptoms to look for, and also the REDS clinical assessment tool, which can help you to identify some of the areas that might suggest a athlete could be at risk. And certainly if you pick up risk, I would be sending them on to a sport dietitian and a sport physician for further assessment.
Okay, I want to back up to your first suggestion of directing your patient to patient forward guidelines and handouts and things like that, because that is such credible information for them. And you're giving them that information because they're going to go Google or chat GPT this question afterwards anyways. Plus, it also kind of shows and says, hey, I'm not the sports nutrition expert, but here are really great programs or departments or companies that you can trust that have these guidelines that you can follow. So I love that answer. So having a few resources in your back pocket to send your patient to is probably the best answer rather than trying to give them a half-assed answer. Now, I've also done a few previous episodes on sports nutrition that I will link down to that you'll love to listen to after this episode. Actually, last September of 2024 was kind of my sports nutrition month. So episode 70, 71, and 72 are all about sports nutrition. And we dig a little bit deeper into the pre, during, and post fueling, which, like Erin had said, is really, really important for our athletes. And then I did an episode on eating for endurance with another sports dietitian that was kind of unpacking endurance nutrition and myths. And we go into a little bit more about hydration too. That's episode 105. So all of those will be linked down in the show notes for you if you want to continue learning all things sports nutrition. Well, Erin, I want to round this conversation out, and we've talked a lot about carbohydrates and the importance of nutrient adequacy and getting enough energy, but I would love to hear your final thoughts on, is there anything else that you wish marathon runners or ultra marathon runners adopted early because you know that would help to prevent injury later on?
Yeah, so something interesting from our systematic review and meta-analysis was the finding of lower total fat intakes, increasing injury risk in younger female distance runners. Um, I think that's something that we haven't recognised so far. We've been really big on the energy availability and underfueling story, but yeah, the fat is a new area, and I think athletes sometimes fear fat, maybe not so much as carbohydrates these days, but fat still sometimes gets a bad name too, because of the high calorie content and perhaps then contributing to unwanted weight gain or difficulty losing weight. I talk to my runners about the roles of fat. It is a really important fuel source, but it is also a source of something that helps to produce hormones like estrogen and testosterone. It helps us to absorb our fat-soluble vitamins. It helps with cell signaling. It's an important nutrient, and we are seeing a relationship with developing injuries in young females. So, we need to be mindful of that. Things like extra virgin olive oil, we've got fantastic evidence for the health benefits of that now, and runners should be harnessing that as well. The people that are using this tiny bit of spray of olive oil on their frying pan, like, that's probably not doing a whole lot for them. So I really encourage them to be a bit more liberal with that sort of thing. I talk to them about their omega-3 fatty acids. We don't know yet, but possibly there could be a role in injury prevention and management for, more adequate omega-3 fatty acid intake, which we know most people don't do particularly well with. So definitely, thinking a bit more about that fat.
Those are really, really great tips. I'm glad you mentioned fat because it is an overlooked nutrient often, and it can be really, really crucial for our patients to consume enough of that. Erin, this has been such a fun conversation. This is so not my area of expertise, so I really have learned so much from you. Thank you for unpacking marathon nutrition for all of us who are working in clinic and maybe come across these patients one day. If my listeners want to connect with you outside of the podcast, where can they hang out with you online?
Yeah, so you can see my personal business website, Ultra Appetites, at www.ultraappetites.com.au. I am also on LinkedIn, so you can look me up under Erin Colbatch. I do have a Facebook and Instagram page for my business as well at Ultra Appetites, and that's probably the easiest ways.
Cool. All of those will be linked down below. So you guys enjoy learning all about sports nutrition with all of the resources down in the show notes. But Erin, thank you so much for the gift of your time today.
You're welcome. Thanks, Colleen.